Okay, so dentures are still used in dentistry, been around for 100 years. A very, very cost-effective way of replacing teeth. Now, of course, we can have dentures that are used to replace all of your teeth, a bit like these. So that's an upper and that's a lower. And we can also have dentures that can replace some of your teeth. And you can see that maybe this is an example of a lower partial denture with a chrome frame. We can make them out of acrylic frames as well. But the big advantages of dentures really are cost. It's a very cost-effective way of replacing your teeth. I suppose that's probably where what people like about dentures stops. After that, what people don't like about dentures is a few things. Number one is they're not super secure. Even a partial denture can be made reasonably secure when they click on the teeth, but when we move to full dentures, we find that they're just not very secure at all, and that's sometimes a real problem for people because they move around a bit and jump out, particularly a lower full denture. Secondly, the other thing people often don't like about wearing dentures is the fact that they cover a fair bit of real estate inside the mouth. So, particularly when you don't have any teeth and you're trying to wear full dentures, particularly an upper denture like this, you can see it's going to cover the whole roof of the mouth and right up around the sides of the gums as well. And it has to have maximum surface area to get the suction required so they can try and stay in. Partial dentures less so, definitely, but they still, cover a fair bit of real estate inside the mouth as well. The third thing people don't like about dentures is the fact that they're removable. So, when you're functioning and chewing, you do need to remove your dentures usually after meals to clean everything up afterwards. But, this day and age, we still do lots of dentures because they're a wonderful cost-effective solution for people and still work very, very well. And we get nice aesthetic results with them with the modern day materials. So they work very well for those that are interested in doing things that way. Often people ask whether you can get dental implants if you've got dentures, and the answer is absolutely yes. We use dental implants all the time to help stabilise a denture, particularly a full lower denture. And sometimes a full upper denture. What dental implants do help us is secure those. It gives us the opportunity to click down these dentures onto something meaningful. Sometimes in the lower jaw we can use 2 implants. Look, 3 implants is better than 2 and 4 implants is better than 3. It's like the legs on the chair, and gives us some purchase points for the for the denture to click down onto. On the upper jaw, the advantages are even more significant because we don't need all of the roof of the mouth and the surface area requirements for a conventional full denture anymore. When we use dental implants on the upper jaw, we don't need the real estate anymore. So, we don't require suction to hold the denture in. So dental implants have been the best thing for dentures, to make them more secure, but also to remove the real estate that the conventional dentures take up in the mouth. Okay, so you're either faced with a situation that you need to lose all your teeth, or maybe you're missing all your teeth already, and you've got a conventional full denture that you don't like. And people don't like these often because they're not very secure. They cover a lot of real estate in the mouth, and they particularly lose fit over time. So very simply on the lower arch, sometimes we can just put 2 implants in the jaw and put a little attachment on them. The little attachment sits inside the denture, and we can click that down to make that denture a lot more secure. What's even better is the use of some more implants to actually have a bar retained solution. So sometimes we can make a special titanium bar that joins the implants that are placed into the gum, and we make a special prosthesis that fits over the top of that and clicks in place. And what you'll notice is that that's a very, very different solution to a full denture. It doesn't cover any of the real estate in there, and these things are rock solid. Okay, they don't move anywhere. And you know, you'll find that these are a much more comfortable thing to wear. The fact that it is removable has huge advantages, so you can keep it clean. All right, because there is another alternative, and that's the All-on X solution, which is, you'll notice it's still got the same dental implants placed inside, but it's actually a screw retained solution that's not removable. So this sits very snugly on the gums. It stays in place. Someone like me can get it off, and we do have to get it off regularly to make sure it's nice and clean underneath, but these things will stay in place as a fixed solution. Okay, there's hygienic issues with these. You've got to be very, very good at keeping them clean, which has a slight disadvantage over the removable ones in my opinion, but a wonderful solution for those that don't want removable teeth.